The chair recognizes Ms. Decker of Cambridge.
Good evening. Thank you, Madam Speaker. Through you to the members, today I rise in support of Consolidated Amendment D. I'm honored to serve as the Public Health Chair during one of the most challenging public health crises we've collectively experienced in our lifetime. Over 17,000 people in our Commonwealth have lost their lives to COVID-19. We will be recovering from grief, sickness, and the loss of stability and security for years to come. It's important we take a deep breath of appreciation for the struggle that many members of our community and even in our own families are grappling with every day. It has and continues to be a matter of life and death, and while no one is immune, some have been disproportionately devastated much sooner and harder than others. Mr. Speaker, I thank you for your steady hand and leadership. It's not hard to imagine all of your years of experience have been building and preparing you for this moment of leadership. I will speak for myself and say it's not an exaggeration to share with you that as someone who has tried to be a steady source of support and comfort to my constituents, your leadership has provided me with that same comfort and confidence to meet the challenges of this moment. To the gentleman from the North End, the Chairman of Ways and Means, it's accurate to say that you too have been preparing for this moment of leadership. I've had the great experience of sitting on 2 committees with you, and it's no secret that I've long admired your skills as a chair and appreciated your support and guidance as a member. You have continued to provide that same leadership for the entire House of Representatives. And to your staff in Ways and Means, to the staff in the Speaker's office, and to the staff who've been coming in the clerk's office, and to our court officers, to our park rangers, to all of you who have not missed a beat in ensuring that we in the legislature continue the people's business. Thank you. Public health is a reckoning of how social determinants lead to disparities in care and access to services and predictable health outcomes. It's often based on systemic racism and economic inequality. I'm thankful that this document was developed with a deep appreciation that's clearly present in the writing and the tough choices reflected in this budget. I will begin by highlighting the House's important investments targeting frontline healthcare workers. These provisions will provide targeted outreach to our frontline workers so that they are able to access resources designed to address trauma related to COVID-19, and will require the Department of Public Health to conduct a study on the impacts the pandemic, that sounds appropriate, the pandemic has had on frontline workers, including depression, anxiety, and substance use disorders. As we slowly try to navigate a vaccinated pandemic life, this study will be used to inform current and future practices related to the safety and the well-being of our frontline healthcare workers. And to them, I say thank you. We stand here today because of your skill and your courage. We are a state that has led the nation in believing access and excellence are essential for everyone in need of healthcare and preventative care. This House budget invests $171 million in our community hospitals and our hospitals serving low-income patients. It also provides an additional $5 million increase from the FY22 budget. This funding provides hospitals with critical behavioral health care services for children and adults, many of whom suffer the disparity and hardship of living in poverty, and for many who've been underserved. Our House, our chamber, continues to lead the way in investing in substance use, addiction, and recovery services and resources. We've committed well above the Governor's House 1 because we know that the current case numbers are not a true reflection of the need in our communities. We know this investment above House 1 is an opportunity to address the alarming trends of death by overdose on the rise due to the isolation of the pandemic and the limitation of accessing resources. The safety and well-being of domestic violence survivors has long been a priority of this House. This budget funds the domestic violence prevention item at well over $50 million, adding an additional $5 million to the COVID-19 Domestic Violence and Sexual Assault Survivors Safety Trust Fund. This funding helps ensure that survivors have access to the services that they need. Our hospitals are seeing a higher incidence of severe injuries due to domestic violence and intimate partner violence. Even when sometimes calls to law enforcement have fallen, care for treatment has captured a more accurate window to the continuation of these assaults. A society is judged on how it cares for its most vulnerable. We continue to invest in our youngest. We know the sooner we identify and meet their needs, the greater they will thrive. The House has significantly invested above House 1, committing a total of over $36 million in early intervention. This is a commitment to families and children from birth to age 3. It means we're helping families with early interventions that can make all the difference. This budget is also mindful of the disparity of economic inequality and racism by targeting funding to communities that have a higher population of families who are economically struggling and whose health outcomes have been exacerbated by COVID-19. Along with our commitment to our very young, this public health budget represents a significant increase to our high-risk youth programs. Well above House 1, we know the remote isolation of learning and the loss of learning due to remote learning has fallen on the shoulders of many of our nonprofits serving at-risk youth. Many of these programs have always provided important out-of-school services to our most at-risk kids. Our investment supports programs throughout the Commonwealth. For many adolescents, these programs have become the only place where they could access trusted, experienced adults, providing them and their families both upstream supports and interventions. It is in these upstream supports and interventions that is the very definition of public health. And this work and this commitment to at-risk youth is ensuring that we will predict better health outcomes for our at-risk youth. Adolescent psychiatric emergency visits have skyrocketed up to 400% in Massachusetts in our hospitals. Between June and October of this year, one hospital alone reported 277 youth in the emergency room, with a 47% increase from the year 2019 in seek of help for suicide ideation or suicide attempts. These programs will go a long way into supporting and addressing the needs of many of our youth who are struggling today. The House of Representatives has invested almost $3 million above House 1 to address the important prevention and care of communicable infections. This includes HIV, AIDS, TB, hepatitis, and STDs. The rising rates of HIV and AIDS continues to warrant our vigilance. This was true before the pandemic and continues to be critical now. We should feel proud of our Chamber's ongoing commitment to funding comprehensive family planning services. This budget represents an increase from FY21. The money provides direct support for reproductive health aimed at supporting underserved communities and adolescents. It provides early detection and treatment for HIV, cervical, and breast cancer. And ultimately, it provides important support to individuals and families in making informed choices on how or if to plan for a family. These services and the care empower more bodily autonomy that is patient-driven and determined. The House continues to invest in the development of game-changing resources that will provide our schools with the necessary tools to meet the behavioral health needs of our students. We know that data strongly supports that implementing school-based health care is effective in promoting healthy behaviors and outcomes for adolescents. School-based health care meets children where they are, both literally and developmentally. This funding helps support health education programs and leads to an increased access to community care. The House support for school-based health care is unwavering. And we continue to make investments in the development of uniform, statewide, high-level behavioral health care for our students across the Commonwealth. I am proud to vote yes on this important public health investments represented in this document. This investment in public health is an acknowledgement in the disparate health outcomes experienced by communities of color, immigrants, LGBTQIA, and people who are suffering in poverty. Today, I ask my colleagues to respectfully join me in voting for the Consolidated Amendment D. Thank you.